After weeks of lockdown, parts of the developed world are slowly opening up. But new infections in developing countries are rising. There are now more new cases in emerging economies, with Russia and Brazil the new hotspots. Experts say a social and economic crisis could be looming.
It has been an exceptionally challenging task, particularly when you look at the lower per capita income economies. They did not have the resources to spend on healthcare systems historically. The second is the availability of medical staff. And the third is the timeliness and of availability of medicines in terms of testing.
Many emerging economies face tough demographic challenges. Not enough doctors and too many people in the same space.
A very good example is India, where even though it was very high up on stringency levels, but the outbreak has yet to be contained, the curve hasn't been flattened. And that's because of migrant workers, new states, large economies. The contagion effect is very high because people are in a very densely packed situation in many cities.
India, other South Asian countries, Indonesia, and Africa are seen as some of the vulnerable spots. But there are also reasons to be hopeful.
Indonesia is different, not just because of resources, but because it's so spread out, thousands of islands and so forth. So the logistical aspects of testing are actually quite difficult in Indonesia. On the other hand, compact, dense population is more risk for epidemic, right? People are spread out, there's less risk. So there are disadvantages as well as advantages in Indonesia. Africa it has limited healthcare resources, many countries there, but their population is mostly young, so they may not suffer in the same way. It's not like we look at developing countries and say, oh, it's going to be disaster.
Another example of learning from disaster. Many governments in emerging economies have prior experience with disease outbreaks. So they're familiar with what needs to be stepped up in a crisis.
We've seen governments move quite quickly to expand their capacity, to bring back, to recommission hospitals that had fallen out of service, for example, and to leverage other parts of the, for example, the military hospitals in some countries have been brought into service as well. So countries have been doing what they can to increase the availability of hospital care.
Emerging countries have also adopted other measures, such as social distancing, self-isolation and lockdowns to control the spread of COVID-19. Such measures can, however, be extremely painful for the world's poorest.
And for every government around the world, this is the challenge between how do we, on the one hand, protect lives by containing the spread of the virus. On the other hand, there are economic consequences. For emerging economies, they have many more vulnerable people. In some instances, tens of millions or hundreds of millions of people who are very vulnerable, who effectively live on what they earn that day. And therefore, lockdowns can have a more severe impact on those people.
From an economic standpoint, it's obviously detrimental in the short term, but whether we like it or not, from a longer term, it is something that has to be done. In the longer term, there's no trade-off between lives and livelihoods, in our opinion. So clearly, they will have to do this at the cost of really lowering the growth in the short term.
To cushion the impact, governments in many developed economies have rolled out stimulus packages.
In an interconnected global economy, South Korea is also where we're able to do business, we're able to go to restaurants and things like that, but the global trade and everything is affected, so our economy is obviously affected. So some level of fiscal support is necessary, regardless of the approach. And with a more strict lockdown, that's going to require a bigger fiscal approach.
But emerging economies may not have the fiscal firepower for such stimulus packages.
Across emerging economies, it's high variance to what extent they've been able to respond fiscally, and that depends a lot on, obviously, coming into this, the levels of public debt, the degree of economic momentum that they had, and so on. But by and large, I think it's for many emerging economies, they're not in a position to be able to respond at the same scale. as we see in developed economies.
But given the scale of the crisis, some economists feel governments can't rule anything out.
This is the health crisis, this is the humanitarian crisis, and for these sort of crises, you really have to go all out to solve them. There is a need for a deep fiscal stimulus, whether you have the fiscal flexibility or not, but in the short term, a deep fiscal stimulus is needed. Two, outside of a few, many emerging markets actually do not have very high public debt levels. For example, if you compare, say, Indonesia's debt level with that of the EU, it is clearly on the stronger side. The only resolution to this is to signal convincingly and resolutely that post-COVID-19, as it gets eradicated, we are willing to fully withdraw this fiscal stimulus and get back on the path of fiscal prudence.
As the region continues to battle COVID-19, there are bright spots. Vietnam lifted its lockdown last month after recording 268 cases and no deaths. Vietnam used a low-cost strategy, which included stringent lockdowns on some districts, aggressive contact tracing, and quarantine of potential carriers.
And there have been measures they've taken, I think, around communication, around practice of social distancing that have definitely contributed to that. But I think other countries are also taking measures as well. And I just think it's too early to be definitive about what are the most successful measures. There are still too many uncertainties around the conditions in which COVID spreads and what factors will be most successful in mitigating the spread of coronavirus.